Hi everyone, my name is Soraya and I am here on YouTube. This is my channel. I talk about skin, hair, health, and it's been a while since I talked about skin and acne. By the way, happy new year. This is a new year. uh what are your goals, guys? What are your goals? But for me, uh same old, the same goals that I had last year, and I'm just hoping to hit them this year. Everything to do with my health, my studies, my work. I hope I'm gonna be able to achieve all of those goals. But going back to what I need to talk about today we're talking about acne, and we'll talk first about the definition of acne, just to remind us, like, most of you just probably know what acne is anyway, but I just want to just remind ourselves what acne is. So acne is the accumulation of like sebum in our hair follicles, and the accumulation of dead skin cells, which leads to skin eruptions like comedones and pimples. And it's something which is usually a long-term condition. So the skin has in the epidermis and dermis area what they call hair follicle or pilosebaceous unit, which consists of like sweat glands, the hair follicle, the oil, the sebum glands. So when there is an uncontrolled production of sebum, which is like oil produced in the skin, there's that overproduction of oil. And then on top, on the epidermis layer, there's the skin follicles, and the skin follicle, I mean not the skin follicles, the skin cells, which accumulate, and if they're not removed in time, they form this covering which prevents the sebum from coming out, and that causes the accumulation of that oil underneath the skin, which causes the pimples. Accumulation of the sebum and the hair follicle and the skin cells in that pilosebaceous unit, or that hair follicle, causes can also cause the overgrowth of normal skin bacteria, what they call Cutibacterium acnes, or before it was Propionibacterium acnes, which is a bacteria which is found on the cells on our skin, like a normal flora. But once this happens, the oil accumulates, this bacteria can overgrow and cause also infections, causing pus within those follicles. So what we get to see are things which we call comedones. There are two types of comedones. There's the blackheads and there's the whiteheads. The blackheads are the open comedones. This is because the pus that is within the hair follicle unit, the pore is exposed, and that exposure leads to oxidation of the particles which are inside there and causes darkening of that comedone, so that's why it's called a black comedone. And then there is the white comedone, which is the closed the whitehead, which is the closed comedone, and that is the parcel. The parcels within that hair follicle is still protected, so the pore is not open, and you can actually see like the white like area like popping off the skin. That's because it's still enclosed. Once it's open, then it can become a black comedone, or rather blackhead. So yeah, so you have those types of two kinds of comedones. And then you have the, I'm not going to go into the whole like classification, but you have like, they have a classification of pimples, cysts, nodules, which can be really large and accumulate like within the deeper layers of the the dermal layers, and cause like damage and scarring, and of course hyperpigmentation. So what causes the this accumulation of oil, or like lack of shedding, or all of those things that attribute to acne. There is you know main reason is genetics. If you have a family which has had acne before, or like a history of acne, you're most likely to have it. It's usually the genetic factor, according to dermatologists, is related to like an immune function and inflammatory function. There is like a defect in your inflammatory markers, like tumor necrosis factor, which causes an increase of inflammation in your skin, or just not able, the skin is not able to clear up like toxins and cells or dead cells or bacteria. So that causes you to have the accumulation of that sebum and cells, and leads to the acne. That's 80% of what causes acne. And so for some people, it's just this condition that happens and you can't really reverse it. The next one is hormones are the second thing that can cause acne. Especially the hormones like testosterone, uh, like internal or external, like what you take in terms of things that can cause the hormones to increase, like the combined birth control pill can is useful in helping like control your hormones, but sometimes hormones like anabolic steroids increase your testosterone and cause you to have more acne. So that interplay of hormones, especially the testosterone and its derivatives like dihydrotestosterone, DHT. There's another one. There are three of them. There's the testosterone, the hydrotestosterone, and I think uh, something progesterone. I forget, the names are hard. Other hormones that can that are related to acne is the insulin growth factor. If you've researched a little bit, you know that the things which hyperglycemic foods which increase your insulin, or like dairy which has like they put in like these hormones for the cows which has the insulin growth factor, has been related to acne, like acne breakouts, and cortisol or stress hormone also is related to acne breakouts. Pregnancy hormones, that just the increase of either estrogen and progesterone during that pregnancy time also causes an imbalance, a hormonal imbalance, which may cause acne. And not just acne, like falling out of hair and all of that stuff. And is growth hormone also can cause you to have acne, or rather like abnormal amounts of growth hormone can cause you to have acne. The other thing is diet. So I said we talked about genetics, we've talked about hormones or hormonal imbalance, and then the third thing is diet. Diet really is 50-50, but as I said, hyperglycemic foods have been noted to increase acne breakouts, and dairy also has been linked with acne breakouts. And as I said, with dairy, I'm not sure if it's the milk itself or it's just the hormones, which are, I know for a fact the hormone, the insulin growth factor in dairy has been linked to acne, but dairy itself, I would have to look into that. I will let you know if I see anything related to that. But I do know hyperglycemic foods like processed foods have been also shown to increase acne breakouts. The other thing people usually think may cause acne is cleanliness, but not really. I mean, definitely you need to make sure your skin is clean for it to reduce or rather improve on the shedding of the skin cells, but cleanliness on its own is not like linked to acne. So there are other internal factors that cause you to have the acne too. So that is what they say in the dermatological field. The other thing that also may be related to acne is, of course, medications. As I said, I touched on the controlled birth control pill, which has been used to reduce acne breakouts by reducing the hormonal or balancing out the hormonal levels. There's also other medications that are related to acne. Those include medications like lithium, which is used for antipsychotic medications, isoniazid, which is a tuberculosis medication, as I said, testosterone as a hormone injection can also lead to acne, and antibiotics have been used to either reduce acne, but some other antibiotics can also worsen acne. I know from my experience, there are some antibiotics which work to reduce the acne, especially if it is like an inflammation or pus filled like kind of acne. Sometimes you have breakouts and you can see like the pussy like kind of pustules on your skin. With those kind of acne, antibiotics have helped. However, when I used some other antibiotics, for example, you know how people give you, I think I was given azithromycin at one point to clear my acne, and that just worsened the breakout for me. But to everyone his own. Every individual is different, so even when you're given these antibiotics by your dermatologist, it's good for you to see how it works with you and see if it is actually helping or if it is worsening the situation, and then you can go back and give feedback to your dermatologist to see if they can change the antibiotic or if you have to stop the antibiotic, and see what works for you. So in terms of the things that I have mentioned, obviously there are things that you can control to see if you can reduce your acne breakouts. The most important thing is eating healthy and drinking lots of water. So if you're eating healthy, including your fruits, your vegetables, your minerals like zinc, selenium, and I think mostly zinc and selenium. There are also other antibiotics, which and not antibiotics, minerals that can help on the skin. But I know for a fact zinc and selenium have been noted to help with relieving skin conditions. And then things like collagen have been used, are good in repairing of the skin. Vitamin C. So those are things that you can either take as supplements or take in food so that you are helping your skin, repair. Taking lots of water to flush out the toxins, to make sure that the blood is flowing well, so that all those chemicals are being flushed out, or your anti-inflammatory, your antioxidants are working in the skin, is very helpful. In terms of antibiotics, I already touched on that. You see what is working for you, see what is not working for you, and follow, take them as prescribed. For hormonal things, be careful in terms of hormonal imbalance. If you think dairy is making your breakouts worse, then I would reduce the dairy. Or maybe just look for other sources of dairy, like almond milk, cashew, rice milk. If those things work for you, oat milk. If you think that is better for you, then definitely take more of that than your dairy, or just reduce the amount of dairy that you're taking. In terms of hyperglycemic foods, try and reduce the processed foods, reduce, you know, like the biscuits, the cakes, you know, all of that processed stuff that may like worsen your sugar or spike your sugar. Take more, if you have to take sugar, take more fiber. So if you're taking, for example, if you've been buying juice or something that's processed, take more of the natural juices which have fiber in them. Take smoothies, and yeah, eat a balanced diet. Eat a lot of vegetables, eat a lot of fruit. In terms of hormones, try to see, like, if it's at the time of the month, uh, that's just normal cycle. The hormones will go up and down depending on the time of the month. So if you're not on like any medications, just try and control what you can control, and just take time to have a good skincare routine, and also something that would reduce the hyperpigmentation, especially for us ladies who are people of color. The most important thing is to try and reduce the breakouts and then deal with the hyperpigmentation. And I'm gonna link a video on the hormones and hyperpigmentation at the end of the video. Yeah, and also what has been good for me, I noticed, to control the inflammation of the pimples is hydrocolloid patches. These are patches which like draw out the the inflammatory fluid. If you've had pimples before, you'll notice that usually there's a tenderness that you get because of the pressure from the swelling, and then also there's the inflammation that you get around the pimple. And you might notice, if it's like an open pimple, you might find like some fluid which comes on top of that area of the pimple. So when I have those kind of pimples, or if I see this the swelling around the pimple is increasing, I use the hydrocolloid patches, which help to reduce that swelling and reduce that fluid which is being produced. You'll see it being drawn out by that hydrocolloid patch, and it's very, very helpful in reducing the time that the pimple is there, and in clearing them in time, so that it's not like affecting the lower layers of the skin. Use it and it will make sense. I might also put in a link for the hydrocolloid patches in the description box. For the hyperpigmentation, I have talked about this before, but you can use the azelaic acid. Helps to reduce the inflammation of the pimple and the hyperpigmentation of the pimple. Benzoyl peroxide helps to reduce the inflammation of the pimple, and it destroys the bacteria, the P. acnes bacteria. Salicylic acid also helps to reduce pimples. Niacinamide helps to reduce the hyperpigmentation. And if you're seeing a dermatologist, then they might prescribe for you, depending on how severe your acne is, like retinoids, which may be, they have a range. There's tretinoin, isotretinoin, retinol, depending on how the skin behaves and the combination of the ingredients, they might give you one or another. Yeah, and those are the things that you can help, which will help you reduce the hyperpigmentation. Some other good videos that you can check out in terms of these ingredients are especially the azelaic acid, the niacinamide, the benzoyl peroxide, and how to use this in your skin routine is Dr. V's skin YouTube videos. So I'll also put a link to that, or just mention, if you can like Google Dr. V's or Dr. Vanita Ratan skin videos, you'll be able to see how these ingredients are able to work for you in terms of acne and hyperpigmentation, especially for people with skin of color. So yeah, this is just a short video as a reminder of what causes acne, so that you can know what to do to reduce your acne. It is very individualistic, so you have to really look at and see what is causing your acne. Try and investigate what causes it, makes it worse. Is it hormonal? Is it dairy? Is it stress? Is it diet? And then try and reduce what you can and have a good skincare routine. So I hope your 2024 will manifest with better skincare, better control of your acne, and an increase in your better skin, and better self-esteem in general. So I hope that you will be able to get some benefit from this video, and if you like it, please hit like and subscribe to the videos. Share if it made sense to you and you wanted to help somebody else. Please share the video, and if you also would like to comment, please comment below. But definitely like the video if you did like it. I want to see a like. All right guys, take care, have a good 2024.